Good afternoon, everyone, and you are very welcome to today's webinar. My name is Dee Ryan, and on behalf of the team at Limerick Chamber, I'd like to warmly welcome you to today's session, where we're aiming to assist you with your preparations to reopen your premises for business from as the government guidelines permit from next week onwards in phase 2 for the retail sector. So today we're delighted to have Antaris with us to take us through the guidelines outlined in the Return to Work Safely Protocol document that the government released in May. There are particular challenges around physical distancing and management of the workspace for both employees and customers for the retail sector, and that's why we've put together this dedicated session. So I'd like to say thank you all for joining us today and hand over.
Thanks, Dee. My name is Nick Smith, as you probably see from the chats. I worked with Antaris for about 15 years, and I suppose the objective of today, as Dee says, is to give you some introductory preparations for the return to work, and specifically to look at some of the guidelines, including the return to work protocol issued by the government, and also some of the other guidelines. There's been some very useful guidelines and pro forma documents that have been produced by the Health and Safety Authority, the National Standards Authority, as well as the HSE itself. And throughout the talk, I'll be referring to those. And you may find that there are quite a lot of slides in this presentation, some of which I'm going to go through quite quickly. The reason for that is that I'm trying to provide you with as much information as I can. Particularly around references, because a lot of the references will give you information on the kind of forms that you can prepare, the kind of requirements for induction for employees, the communications preparations that you need to make, and the processes that you need to have in place, both from the point of view of the organisation itself and from the employee's point of view. And also to assist with both the risk assessment and the control processes. So we'll talk more about that as we go through. So the outline of the talk, I suppose first of all I'll give you a brief introduction on SARS-CoV-2, which is the kind of official name for the virus. We'll talk a little bit about legal requirements at work. So what are the background legal or legislation which is underpinning the requirements for returning to work during the pandemic, and then more specific information on the retail environment. So that's where we'll focus our attention for the majority of the talk. And then I'll give you a brief review just to look at the different steps and just a reminder of where you can find information on each of those. So the virus itself, it's the latest in a series of coronaviruses. These have been around for a number of years now, and SARS, the first part of the name of the virus itself, stands for severe acute respiratory syndrome, which you will probably recognize from the description of the symptoms that have been released and outlined by the HSE. So there have been a number of different outbreaks over the probably since around 2000, and the SARS-CoV 2002 and the MERS, which stands for Middle East Respiratory Syndrome, in 2013. Were probably the most similar to the current virus. The main difference is that those viruses were significantly less contagious than the current virus, SARS-CoV-2 or COVID-19, and the coronavirus that we have now is what's causing COVID-19. So this is just a a photograph of what it looks like. You'll have seen all of the kind of images that they show on TV, where you can see all these spikes that are sticking out. This is what it actually looks like at a microscopic level, and the spikes are there. It's just they're a little more hazy on this. So what the spikes do is they actually adhere to enzymes in the blood and in the lungs in particular, and that's the way that it gets into the system. It spreads in a similar way to flu, I suppose. Coughing or exhaling droplets of infected fluid. The droplets get into the environment. It doesn't hang up in the air like an aerosol. So it's kind of a direct release, and you're either there to catch it or you're not. Droplets fall on surfaces as well, and there's been a number of studies done to try and figure out how long the virus actually continues to live on a surface, and the results have been quite varied. So it's not really known. There is a general assumption that if you have contaminated material, or possibly contaminated material after cleaning, that if you retain that for 72 hours, just put it in a normal waste bag, that it's then suitable for going to general waste, because any of the virus remaining on it will have died. But if you do contact droplets which still have live virus in them, you touch your mouth or your eyes or your nose, that's the way that the virus can access your body and spread the disease. If you're standing within 1 meter of a person with COVID-19, they can catch it just by breathing in the droplets. Or you can catch it just by breathing in the droplets. I just got this. This is just a little visualization of the way that the virus is spread. I hope it'll work now when I click on it. But it just shows the numbers on a global scale of the people who have died from the virus since the start of the year. And it starts down near the bottom and quite quickly moves up to the top in terms of the numbers. So it's quite striking. So I'll just show it to you for that reason. So you can see the number, COVID is down at the bottom. Can't even see the color yet. This is back at the end of January. So now it's starting to creep up into February. Middle of February, seeing numbers, but at that stage it wasn't really causing a problem. But really in March, it took off, and you can see this is the surge that they spoke about on a global scale. So, by the time we're getting up to the end of May, you can see it's the single biggest killer worldwide, and it's outstripping malaria and well over 300,000. So that's really just an illustration. The symptoms, as you'll probably be aware, most people who are infected with it, have relatively mild symptoms and recover. Now, relatively mild symptoms can still be extremely unpleasant, but there is a full recovery in a relatively short period. 20% of people experience more serious illness and need to go to hospital, and maybe 5 or 6% end up in ICU. And people with weakened immune systems and people with certain conditions, including diabetes, heart and lung disease, and people who are older are also more vulnerable to serious illness. And as we've seen in Ireland as well, in particular, and in other European countries, people in age homes have tended to suffer particularly. So that's just a little bit about the virus itself. I think we've probably heard quite a lot about that over the last months. These are some of the pieces of legislation which are applicable. The top one there is the COVID-19 legislation, which was brought out by the government earlier this year, and it has quite wide-ranging implications, and is really an enabling act, if you like, which allows them to bring in subsequent legislation as they deem fit. The Safety, Health and Welfare at Work Act is also relevant to employees, as is the Safety, Health and Welfare at Work biological agents regulations, and there are a number of other pieces of legislation as well which are relevant, but they're probably the most significant. So the emergency measures in the public interest introduced, as you know, restrictions on travel to and from the state, to and from certain geographical locations, and then it started to require people to remain at home, prohibiting events that pose a risk of infection, placing safeguards on organisers on the type and the number of people in order to limit the spread of the disease, and any other measures that the Minister considers necessary in order to prevent, limit, minimise or slow the spread of Covid-19. So that last part does allow for future measures that can be introduced under this Act by a statutory instrument. So there hasn't been too much of that, but there have been a number of amendments, including the rollout of the gradual reintroduction of work and of business. The Safety, Health and Welfare at Work Act 2005, it's quite a long act, and I'm not going to go through it really, but basically what it requires is that employers take a high level of consideration of the employees in particular in their workforce. So that requires that you conduct risk assessments on any kind of a hazard that's in the workplace, including biological hazard like COVID-19, and provide safe systems of work and facilities, training, help in controlling and through engineering controls and particularly through avoidance if possible, and also as a last resource, I guess, providing and maintaining personal protective equipment to be used by the employees. So this is a very general piece of legislation, but it comes down to conducting a risk assessment, identifying and assessing the hazards that can cause harm to people, putting in adequate controls, and making sure that people are aware of those controls and that they implement them. The biological agents regulations are also applicable in this case because you could, I mean, SARS-CoV-2 is a biological agent. It's a particularly hazardous one because we don't have either a cure or a vaccine. So really the main things that can be done is just to keep exposure, the number of employees that could be exposed to an absolute minimum, designing work processes and engineering controls to avoid or minimize the release of the biological agent into the workplace, and using hygiene measures, including looking at the way waste is handled in the workplace. And the personal protective equipment regs are quite specific to just what kind of personal protective equipment is provided to employees and to others who may be affected by work in the business, how it's managed, how it's issued, and how it's controlled to make sure that people who need to be wearing it are actually wearing it. The problem with PPE is that it is dependent on people actually wearing it. It only protects the person who's wearing it, and it depends on the way that it's worn as well. And so you will even see professional people who use masks and respirators, putting them on incorrectly and leaving gaps and things like that. So they're not a cure-all. They're something that can be introduced, and they may be of assistance, but they're not going to be the only solution to a problem like this. This is just the kind of protection that you would often see for people who are in, I suppose, in the general retail occupations, where you have a general type of mask and maybe coveralls and gloves and things like that. In the healthcare sector, they have more specific types of masks which will give them specific protection against biological agents like viruses and bacteria, and also cover the eyes and the nose to protect the membranes. So risk assessment. Okay, so for whether it's COVID-19 or anything else, the first thing that you need to do is to identify what the hazard is, and then identify who could be affected, how they could be affected, and what the level of risk is that's involved in the exposure. And based on that, you decide on the level of risk, and based on the level of risk, you implement controls. So there is a requirement under the legislation to conduct a risk assessment for COVID-19, and I think I have I do have a reference in one of the later slides, which will give you a pro forma that you can use to actually conduct the risk assessment. Basically, the hazard is the same for everybody, so it really comes down to the way that exposure can happen in the environment that you're operating in. So specifically for the hospitality and retail sectors, it's about making sure that people can circulate and can do the ordinary transactions that they would need to do in a safe way, and without unnecessary exposure. This is just from the Health and Safety Authority. So they have guidelines on risk assessment, but they also have guidelines on just about everything else that you need to document for going back to work. So the first one there under the template, you see it says the return to work form. That's the return to work form, which is to be completed by employees within 3 days 3 days prior to them returning to work. So that's a template that you can use to develop your own pro forma and give it to employees. If they've already returned to work and they haven't completed one, you can just use the same form and just circulate it to them and keep a record of it. There is the second template there then is a response plan. And what that covers is all of the remaining elements that I'm going to go through now, from you preparing to return to work, conducting the risk assessments, communicating with employees, getting the forms out to them, preparing the workplace for return, having a communication strategy in place, having strategies in place for social distancing and for hygiene, and for communications with employees and with other people that are going to use the premises. And I suppose particularly having a process in place for when you suspect or know that there is somebody on the premises, an employee who has symptoms of the virus. What do you do in that case? Where do you take them? How do you get them there? And what's the next step once they've been isolated on the premises? So it will talk about all those things, and then it will lead you into the various checklists that you can use. So planning and preparing control measures, the induction for the employees. There's a detailed induction form there that's provided by the Health and Safety Authority. Dealing with suspected cases, as I mentioned, and then cleaning and disinfection after a suspected or a known case. And then there's checklists for workers, and there's a worker representative checklist. So there's two individuals who need to be identified for the business. Or in one case, in fact, for the employer's representative, it may not be an individual, it may actually be a team, depending on the size of the business. And the other person that needs to be identified is a representative of the workers. who can help in introducing the measures with the colleagues in the workplace. So these are just some helpful guidelines as well that we've picked up. The top one is from actually I'm not too sure who the HPSC is. I can't remember. But it's guidance on for both employers and employees. The NSAI, the National Standards Authority, had their COVID-19 Workplace Protection and Improvement Guide, and they also have a specific one for the retail sector. And some of the material that I've used here, actually, I borrowed from them. It's quite comprehensive, and it's a very good guide. The HSE have guidelines on implementing social distancing and conducting risk assessments in the working environment. And the government again has the Return to Work Safely Protocol, which is the basis for all of the guidance and for the measures that need to be taken prior to and after returning to work. So I suppose the first thing, when workers are coming back after they've provided you with the form, basically telling you that they're not at risk of having COVID-19, you need to develop the training requirements for them, and this includes contractors who may be on site with the employees. It's also suggested that you consider cross-training workers and establish arrangements to minimise disruption. But it depends very much on the circumstances of the business as to whether that's an appropriate measure or not. But the guidance on this is provided in the HSA Employer Checklist 3 COVID-19 Induction, and that includes providing the following information. So the symptoms of COVID-19, how it spread, physical distancing in the workplaces. So how you're planning to do that. What do you need from them to make sure that can happen? The importance of cleaning routines, what are they? And hygiene controls. So, and as well as giving them the induction training, it's important that they get fairly regular reminders on that. Use of personal protection equipment and other equipment as necessary. So in a lot of retail environments now, you'll have seen that they've introduced perspex guarding in front of people at checkouts and places like that, and other equipment includes obviously the equipment that's used for hygiene and for sanitation. What to do if an employee or a member of the public becomes unwell or have had contact with a confirmed case. So exactly, and like that is something that needs to be identified in each workplace, and I'll talk a little bit more about that later on. What do you do about cleaning after a suspected or a confirmed case? Generally, cleaning is, there's two aspects. There's cleaning and then there's disinfection. So you need, first of all, to make sure that surfaces have been adequately cleaned and that they look clean. So there's no debris or dirt that's visible, and then you can disinfect the surfaces after that, using generally either a bleach, or if your circumstances don't permit a bleach to be used, you can use an alcohol solution where the concentration is at or above 70%, generally above actually. Yeah, I mean, there are some businesses that still won't allow bleach, so you need to find an effective alternative to that. Waste disposal. So in some circumstances, waste disposal, it's fine to keep the waste from cleaning if you don't have any confirmed cases and you're not operating in a healthcare setting. Retain the waste for 72 hours, as I mentioned earlier, in a secured location. In a closed container or a tied up bag or something like that. Keep them for 72 hours and then you can put it in the general waste. The biological agent will have died at that stage. What are the travel restrictions? And I suppose most importantly, the overall COVID-19 plan for the business. So returning to work, as I mentioned, you have the pre-return to work form for workers to complete at least 3 days in advance of the return to work. And you'll find that again in the HSA templates under return to work. You'll get all the HSA stuff under www.hsa.ie. And the questions: do you have a cough, fever, sore throat, runny nose, breathlessness and flu-like symptoms now or in the past 14 days? So that's, that could cover quite a few things other than COVID-19. But I suppose the idea is we need to be particularly cautious. And if people do have signs of COVID-19, they need to talk to a medical professional before returning to work. Have you been diagnosed with confirmed or suspected COVID-19 infection? Are you a close contact? And I'll talk a little bit more about what a close contact is shortly. Have you been advised by a doctor to self-isolate? Or have you been advised by a doctor to cocoon? So I'm not even too sure what the difference is between self-isolation and cocooning, but they both basically mean that you don't come into contact with other people. And there are other guidelines there from the government information publications, supports for business, which include things like other return to work forms. They're all basically looking for the same information. But it's no harm to check all the available resources. So the specific risk assessment for COVID-19 needs to be conducted for the working conditions, the controls that you have, and the people that are going to be involved. So if you've got any people who might be particularly susceptible to picking up the disease, or may be particularly affected by it. So you must have a documented procedure or protocol so that you make sure that you have a consistent approach to the risk assessment. And you need to look at things like the susceptibility of the personnel, the activities that are planned to be conducted, the current status of the pandemic obviously, particularly important government and health authority guidance. If you do run into problems or somebody gets you do have a case of COVID-19, if you can say that, look, we've complied with all the guidance and all the health authority and the legal requirements, then, there's nothing more that you could have done. And also, you need to consider what available PPE equipment and other controls are there in the business. Try and prepare as much of those in advance as you can. And the HSE have there's a good link there to some of the measures that the HSE are actually taking themselves in terms of risk assessment. So that's well worth having a look at too. So the risk assessment, you'll have a safety statement and a risk assessment process already. So it's really just applying that to the COVID-19. This is just an example of the kind of likelihood versus severity and the different criteria that can be used to put numbers on it. Basically, what you're trying to make sure is that the controls that you have in place are adequate for the risk to the employees and to the other people in the business. So when you've determined the risk, it's likely to be in an area, it's either going to be a high risk, moderate risk, or a relatively low risk. And the measures that you take will be dependent on the level of risk. This is basically the return to work plan, and the template for that is covered in this link here. But basically, it's going to be around making sure that you have an overall plan, that includes your policy on COVID-19, that you identify people who are responsible for performing specific tasks in the organization, that you make sure the employer information is filled out on the form, and that you use the checklist to plan the overall response. And if you do that and continually communicate and consult with management and the employees, then you'll be meeting the requirements of the legislation, of the guidance, and of the Health and Safety Authority. So what we're trying to do, obviously, is break the spread of the infection. And I think you probably see from the news and the current level of infection and the fatality rates that we seem to have done quite a good job on this. But the infection is still out there, and there could be a second wave. And what we're trying to do is prevent that from happening. So the infection spreads obviously from the agent to a susceptible host through an entry site. You have the means of spread. In this case, is the droplets containing the virus, and then you have coughing and sneezing and breathing out, and the potential for further spreading the disease, which then you end up with a reservoir of disease, which is available for passing on the illness to other people. So we need to try and break that chain. Hygiene is one of the major ways of doing that, and providing people with information and guidance on how to conduct hygiene. Washing hands regularly, avoiding touching the face with hands, like I did a couple of minutes ago. Using hand gels or soap and water to keep your hands clean, and washing regularly. And this is particularly important in hospitality and the retail sector. Regular reminders to staff, and regular washing of hands, and again reminders about avoiding touching the hands of the face with the hands, and coughing or sneezing into the elbow and things like that. The link here is to the HFC have a number of posters and signs that you can access free from them, and that link will bring you to that location. And they're the kind of signs that you'll see up, the yellow signs that you'll see in the stores at the moment. So physical distance, again, breaking the chain. It's important to keep people at a sufficient distance, and I suppose at the particularly hazardous points in stores and in hospitality areas. The entrance to the building, the entrance to the store, points of sale where people are meeting with the client, on the shop floor where people are walking around, or walking around hotels or other businesses, warehouse areas, delivery areas, and one of the things which I'll mention later is. One of the measures that can be taken is by zoning each of these areas or other areas that can be zoned in such a way as to keep the staff in those areas separate from the staff in all the other areas. So you create a zone, and those people are kept away. Say, for example, if you're working on security at the entrance to the store, you don't spend time at the cashier's desk. If you're working on the shop floor, you don't go to the warehouse, and vice versa, that kind of thing. And consider things like one-way systems. I've seen those work very well in some of the larger stores. It just means that you don't have people passing in the opposite direction, obviously. Floor markings, again, some of those are available from some of the links that I've provided in the presentation. Signage. And I suppose supervision is particularly important. So that there are people around who are assisting not just employees but customers in complying with the regulations and the rules, and that could be done in a friendly way and without confrontation. But it is important that people are reminded of the rules. If 2 meters isn't feasible for you, and this could occur in a number of instances. For example, if somebody's coming to a till, 2 meters is going to be very difficult if they're paying with even if they're paying with a non-contact card. So that's where you might consider putting in things like physical barriers, such as plastic guards between workers or between workers and customers. But if you can't keep 2 meters, then try and maintain at least a distance of 1 meter as much as is reasonably practical. Minimize any direct contact and provide hand washing facilities close by. And as well, particularly if people are handling money, they should be able to wash their hands regularly or use a sanitizer. You know, you see a lot of people wearing gloves, but leaving the gloves on and handling money, and then, you know, taking money from the next person or giving change or giving a receipt with the gloves on, it's pretty much the same as not wearing the gloves in the first place. You're just passing on the contaminant on the gloves. It's better by far to have the washing facilities close by. So again, as far as reasonably practicable, you know, it wouldn't be feasible for somebody to be washing themselves after each customer either. So it has to be reasonable. And the other thing you need to be careful of is if hand washing and hand washing can provide a problem for some people with broken skin and drying of the skin, flaking of the skin. I haven't seen any evidence of it. But I would imagine that would provide a way in for the virus as well into the bloodstream if you've broken skin and possibly the skin is bleeding. So moisturizer and I suppose gloves where necessary. Face masks should be available, and again, you know, face masks there is evidence that face masks are effective. Maybe not as effective as a proper respirator, but there again, you know, the kind of formal respirators like the FFP2 and the FFP3 respirators that are required, until there's a ready supply of those, really they probably are better confined to healthcare workers, where they're dealing with people who are actively ill and could infect them more readily. Adhere obviously to physical distancing protocols and avoid making close contact with people. So, you know, things like shaking hands, just the ordinary basic precautions. Again, you know, the other precautions that can be taken: reduce time spent in close proximity, have the signage in place, staggering times for collections and deliveries, reducing office density and support staff, and where possible, working from home. Adjusting routes to allow physical distancing, so walking routes as well as kind of the delivery areas. Restricting or staggering the use of canteen facilities, maybe having canteens open for slightly longer, and confining, maybe having one zone at a time in using canteen facilities if you decide to go the zoning route. Removing tables and chairs from the canteen, and possibly doing that from other areas as well where people will be together. Using technology for meetings, so things like Zoom. We've all become kind of experts on Zoom at this stage, and I never even heard of it a couple of months ago, and I'm using it several times a day these days. Limit the number, length, and number of attendees at meetings. So you know, if you need to have people in a room, keep the numbers down, and where possible, even if they're in the same building, use technology to contact other people. The shift handover should allow physical distancing. So I know a lot of places now are actually doing away with the shift handover, where one shift actually talks to the next shift and they're leaving them a report rather than actually physically meeting them. Altering shift patterns, and maybe isolating individual buildings, as I mentioned, in terms of zones, to keep people to their own zones as much as feasible. So visitors, only business critical visitors should be permitted on site. And if they are coming on site, they need to know that, that there are requirements there and that they're going to be required to meet them. And they need to also confirm that they haven't been close contact or have visited any other countries, for example, in the last 14 days. You also need full personal contact details, because if there is a case, then they may need to be contacted subsequently. So restructuring and splitting teams and shifts. So this is one of the methods we mentioned. So revising rosters and splitting teams. So the idea is to have each team, and you may need to move people between teams so that you have a full complement of skills and maybe experience as well on each of the teams, and then avoid people being switched between shifts and teams unless it's absolutely necessary. It may be necessary under some circumstances, obviously, but the idea is that you try and confine people to a specific group of contacts. Stagger the shift changeover for cleaning and disinfection of shared equipment. So if people are coming in and they're having to hot desk, for example, then the keyboards and the mice and any contact surfaces should be cleaned between one shift and the next shift, and also reduce the interactions between the personnel. Minimize the sharing of equipment and or tools where possible, for maintenance staff and people like that as well. And if there are non-essential operations, if they can be identified and suspended, that may or may not be a feasible thing to do. So zoning of work areas, again, I mentioned a few times. Work areas can be divided into zones with people allocated to work within each of the zones. And they can be identified maybe by colour or numbers section, etc. And then when you've identified them, marked them out, colour coded them, whatever, then you minimise movement between zones. And it is, you can use it in retail settings, warehouses, distribution centres, and typical zones could be checkouts, retail areas, the warehouse or the canteen. Cleaning and disinfection, mentioned a few times, obviously very important. Prior to starting shift changeovers, and particularly for touch zones or frequently touched objects or surfaces, there should be a policy and a specific frequency for cleaning them using disinfectant. So trolleys, baskets, entrance doors, handles, self-service scanners, card readers, customer-facing countertops, handles and refrigeration units, weighing scales, manual handling equipment, communication equipment. And where possible, things like weighing scales, if they can be taken out from kind of retail areas where customers might use them, and confined to retail staff, that would be beneficial as well in terms of reducing the transfer of the potential transfer of the virus. So communication consultation, I suppose one of the earliest things that you might consider doing when bringing workers back is to identify somebody to be the COVID-19 coordinator and a lead worker representative for COVID. So the COVID-19 coordinator is an employer appointee. So that's somebody that's employed by management and is responsible for planning and coordinating the COVID-19 activities. Now, that, as I say, in a larger organization, one person won't be enough. You need a team, and the number of people, should be commensurate with the scope of the size of the buildings, but also of the number of people. And the lead worker representative is an employee person who works with the employer to assist in implementing the return to work safety protocol. So this is the return to work protocol is requiring the lead worker representative to kind of be the employee who will represent employees in consultations on the COVID, and to make sure that their views are understood by management, and it is a requirement of the protocol. So you need to make sure that communication is effective, up to date, and reliable, and it may change. To date, we have seen a number of kind of what seemed like hard and fast information changing over time. Clarify the company's procedures and policies. Ensure visibility regarding resourcing and operational needs. So in other words, management need to have that management person needs to understand the overall requirements for the business based on the plan, and be able to see that those resources and requirements are available. And provide up-to-date signage in appropriate locations. So as I mentioned, it could be a team or it could be a single person, depending on the complexity of the organization. Communication is not just within the business, so there will be other interested parties, potentially, or particularly, I suppose, suppliers, service providers, people that are essential to keeping your business going. Discuss business continuity plans with them, make sure that they understand what the requirements will be for them, and if there are elements of your plan that could restrict the amount of time that they can spend on the premises, the times that they can come and go, who they can send, that kind of information is obviously going to be very important to them and should be notified as soon as possible. Similarly with customers, there will be essential customers that maybe really important to the business, in the same way that some suppliers will be essential. So make sure the plans are in place to meet their needs, if it is necessary to look at alternatives in terms of suppliers, then try and plan that out at an early stage as well. And identify other stakeholders in the local network and share best practice. So, if you're in the hotel business, other hotels, retailers, similarly, there will be solutions that people have come up with that they will be willing to share with you. And nobody has all the answers in this pandemic. And from a management point of view, it's important that managers have the answers for people in terms of the legal requirements, and the legal, I suppose, the legal requirements on employees, but also their rights under legislation. And things like, what about, somebody's out, if they have COVID, if they don't have COVID, what's the sick leave situation? Could there be layoff or a short time, and, I know people who have brought in kind of a week on and a week off for people. What about force majeure? And, things like that, where people just, and there will be a lot of cases like that potentially where people just don't have they don't have the childcare facilities, or other facilities that they would normally have in normal times. Employment Equality Acts, payment of wages, organisation of working time, things like that. People may have questions about those as well. And a communications coordinator is recommended to centralise the information. Now that could be the same person as the COVID coordinator, or it might be part of the team. You need to have information as well about absences, about if somebody is out, how long could they be out for? Other operational issues and problems with suppliers or other related issues. So in real time, all that information, you need to have a process for collecting that and making sure that it's visible to central management, and plans can be developed around that. So there's a bit, this isn't really a business continuity presentation. We've touched on it a little bit, but there is a lot more information out there. And one of the better guidance that we found was this planning checklist from the government, and it's preparatory actions for the outbreak. So additional strategies. So outside of premises, I suppose particularly retail premises, and you'll have seen these in the kind of big retail stores. Queues will need to be managed. You need to have correct distance markings, and from what I've seen, if you think you've developed a long enough queue, you probably need to add more. And then you need to make sure that the queues do maintain the physical distance, both within the queue itself and from any other queues that are developing in the area. You need to have somebody around to keep an eye on things like that. Have signs up that give people information on, some stores, for example, have a policy that they will not permit children. You should have signs, and also maybe verbal messages as well about what's acceptable in terms of behaviour towards staff. And be kind to each other. There are still difficult times for people. Signs on public responsibility of personal sanitising as well, and physical distancing. So what do people need to do themselves? Making sure that there's hand sanitizer available, particularly at entrances, and if people are using trolleys or baskets, that they have a means of cleaning them themselves. But also that you do have a regular process in place for cleaning them outside of any cleaning that might be done by customers. And control of numbers. You'll see now at the moment that there's a lot of special access times for old age pensioners, frontline workers, people with disabilities. As I say, in a lot of the larger retail stores that have been open, they've had time to develop those, and they seem to work quite well. But again, signage will assist people in complying with that. Limit the numbers accessing the premises. If you allow too many people in, it's just impossible to keep the physical distancing. So identify the numbers that you're going to be comfortable with, and make sure that you're monitoring that to keep below those numbers. And limit access for children if you can. Obviously, there may be people who have no choice but to bring their children. But in general, the advice should be that if you can avoid bringing children into the premises, then it should be done. Introduce and promote delivery services if you can. My daughter actually works, she's a chef, and they're kind of a high-end restaurant, but they've introduced a delivery service now, and they're going really well. It's an option, and the problem is, of course, it probably will go away when people can go to the restaurant again. But it is an option for the short term. Again, as it says, prioritise delivery services to the vulnerable if you can at all. Within the retail unit, additional rules. These are all just ideas. You may not be able to do all of these. In fact, you probably won't. But where feasible, these will assist. So try and make sure there's only one trolley per customer. And actually having a trolley can assist in the social distancing as well, just by having that physical barrier there. You can see some self-service activities, but I've noticed that a lot of the bigger retail stores haven't done that, and have chosen instead to use just social distancing, making sure that there are sufficient gaps there. Cover bags and food that can't be washed, so bread and things like that. Setting up screens and barriers, as we mentioned. Contactless payments, obviously where possible, and some stores as well have increased the amount from €30 to €50 that you can do contactless payments with. Closing in-store public eating areas if possible. Well, at the moment, is necessary. Keep people monitoring to make sure that the physical distancing is there and have the floor markings, and reduce access to specific lanes when the shelves are being restocked. And again, regular PA announcements on physical distancing, and on just taking hygiene precautions as well. So in warehouses, which some of you may be operating, again, try and have a controlled access process in place, and limit it to business critical visitors. So again, sanitation, declaration of any specific contacts or overseas travel in the last 14 days. Keep supplier drivers separate from the warehouse itself, and request that drivers aren't sent in who have travelled from affected areas. Well, yeah, I suppose all areas are affected at this stage, but potentially, if the drivers can be reduced, certainly from those who have travelled abroad or who have come into close contact with potential people suffering from the illness, and provision of sanitation kits to drivers so they can clean their vehicles. And this is more to do with your own vehicles, including forklifts and things like that, so that they can be cleaned, especially if vehicles are going to be shared between different people over different shifts. So I suppose the next part is particularly important. You may or may not ever come across this, but you don't want to be looking around for the solution at the last minute. So you need to have a plan in place, and it should be part of your overall return to work plan. So you'll need a process to identify workers with symptoms of COVID-19 before the start of each shift, or people who may be suffering from the illness during the day. Make sure that employees know that they need to report to the manager immediately if they have any such symptoms, and make sure that you have a defined response structure. Really, there should be somebody responsible. There should be a location that they can be taken to, which can be secured, and the route to that location should also be fairly secure, so that there can be at least 2 meters of distance provided to the person who is being isolated. So, as I say, the response should be included in the response plan. As I say, a designated area with a designated route, and it should be easily accessible, including for people with disabilities, and it should have the ability to isolate the person. So you should have a closed door on it, and it should have some ventilation, and there should be, and when I say ventilation, I mean to outside, not to the rest of the store. So it shouldn't ideally be a room within, in the centre of the business, and there should be hygiene. Practice. You should be able to. The person should be able to practice hygiene. They should have tissues, hand sanitizer, disinfectant, gloves, masks, and waste bags for any of the tissues or any waste masks or other things that are generated. So apologies, I'm coming up to an hour now. So, but I think this part is particularly important. So if someone displays symptoms such as a cough or a fever, difficulty breathing, get them isolated in the area as soon as possible using the isolation route. Ensure 2 meters distance from the person and provide them with a mask and request that they wear it. So you then need to look at, well, can we ask them to go home and call their doctor? Do they have the ability to do that safely? Or do we wait with them in the area, call the doctor and get advice as to what the next step should be? But the important part is that they're in an isolated area, that they're comfortable, that they're provided with the required hygiene tools, and that there's a means of communicating with the outside world, so their doctor can be contacted and a decision made as to what the next step should be. They should avoid touching people, surfaces and objects as much as possible, and advise to cover their mouth and sneeze, and put the tissue in the waste bag. But I suppose most of all, if they can be provided with a mask as well, that would be good. Yeah, so this is kind of just a quick process map, if you like, for that. So you have an employee who's unwell, reports to the supervisor or HR. So you get some travel history from them, and the contact or contact history with other people as well while you're talking to them. And the employee contacts the doctor to, if it's an employee, to talk about what the potential risks are if they haven't got a contact history, or they haven't been outside of the state in the last 14 days. If they do have a contact history which suggests that they may have been exposed, bring them to the isolation area, facilitate employee contact with the doctor or the HSE, and notify management, and note down names, contact details of people working in the same area, and close contacts. So if there has been contact with confirmed cases, staff should be advised that they must stay at home for 14 days, follow the restricted movement guidance, and they should be actively followed up by the COVID-19 manager or response team. And in terms of what does close contact mean? Close contact in terms of somebody who has a suspected case, and there's been some controversy over this, and this is where the guidance sometimes can be a bit confusing. It means greater than 15 minutes face-to-face, less than 2 meters distance with a confirmed case in one day in any setting, right? So that's where somebody is showing symptoms. In general, what they say is close contact is over 2 hours, but that's in general. So that's where somebody may have been in contact with somebody who's a confirmed case. This is where somebody may have been in contact but is showing symptoms as well. So it is a bit confusing, but this is the definition for close contact in the case of somebody who is showing symptoms. Passengers on an aircraft sitting within 2 seats, and household contacts as well would be seen as close contacts. So the idea is that if you have shared a space with somebody for longer than 2 hours who is a close contact, then public health will need to conduct a risk assessment. And where possible, where individuals have had a close contact, then it should be identified on a contact log. Now, ideally, on a daily basis, your contact log should show 0 close contacts. But this is in case on an exceptional circumstance that a close contact has occurred. So this can be done using sign-in sheets, clocking systems, logbooks, various other methods, and some of these are actually available in the links that I've included. So this is just finally a quick summary. I know I've gone slightly over time, and apologies for that. But so I suppose first of all, you develop a return to work protocol, review the available guidance and the legal requirements, which you'll find throughout this presentation, which will be made available to you after the presentation. Provide a return to work questionnaire to employees, again based on the HSA guidance. Prepare the workplace, so have your signs in place, your floor markings. Have identified where you're going to need screens or other means to keep people separated. Have your cleaning schedule set up. Have your hand sanitizers in place. And just generally have the kind of physical plans in place, and have a high level of visibility of COVID-19 precautions around the premises. Document your risk assessment and include it in the safety statement. Provide your induction to employees. Complete the various checklists that are included and have been referenced. Appoint and train an employer and employee COVID representative. And then make sure that you give plenty of reminders to staff and customers about the hygiene precautions, about the social distancing, about where to go to find sanitizers and the other things that they may need to clean, trolleys and things like that if applicable. Make sure your isolation route and the area for the COVID cases is maintained and is kept supplied. And if you do have case, make sure that it's effectively cleaned and disinfected. Implement supervision around the premises where, as much as necessary, particularly where there's queuing, and maintain and review your contact logs for people. Communicate regularly with the employee representative, make sure they're up to speed on what's going on, you know, and they don't have any kind of issues that haven't been discussed. Review any incidents or issues as they arise, to try and figure out if something went wrong. You know, what do we need to do? You know, have we got an issue in a particular location of the premises, or you know, do we need to look at the number of people that are allowed in, that kind of thing, and implement your improvements then based on experience. So that's it. It's just a fairly quick fly through, because as you can see, there's quite a lot of detail in it. You wouldn't have a scope in an hour to kind of cover all of the provisions and the various checklists and resources that are available. But I hope I've given you an idea where to look for some of the material in more detail. And if you follow this overall plan at the end, you should be in good shape to get back. Thank you very much.